everybody, Raul Lona here from M3 Physical Therapy. So you're having shoulder pain, and usually if you're having shoulder pain that is acute, you've been told to rest. Sometimes that is an indication. However, what we're seeing now is that rest can actually make things worse. So we want to show you three basic exercises that you can do right away to start the healing process, start making your shoulder feel better, and possibly start getting your movement back that you probably lost because of the pain. So the first exercise we want to go through with you is scapular retraction. With scapular retraction, I'm going to have Steve go ahead and turn and face the other way. You want to get the muscles of the shoulder blades working to pull the shoulders back and better position the shoulder so that it doesn't get strained in the front. Most sources of pain for the shoulder is going to be in the front of the shoulder. So we want to pull the shoulder slightly back to take some of the pressure off the tendon if this is more of a tendon problem. Okay, so what we're going to tell Steve here is go ahead and squeeze your shoulder blades back. Good. But see how he's bringing the shoulders up toward his ears? One of the cues I'm going to give him, Steve, try that again, but this time try not to pull the shoulders toward the ears. The shoulders and the ear are not friends. So you want to just squeeze from the bottom part of the shoulder blades and actually pull slightly down. Perfect. And you want to hold that there for 3 seconds and release. And again, 3 seconds, pull down and back and release. Very nice. You would want to go through that about 10 to 12 times, 3 separate sets, and you want to do that once a day to start. Okay. Remember, if any of these exercises cause any increased pain, please stop. Okay, so the second exercise we want to work on is starting to strengthen the shoulder a bit. It's called external rotation, and the specific exercise is an isometric. Isometric means that you're going to create force, but you're not going to get any movement through the joint. This is a great exercise to start to strengthen muscles without causing any increase in strain or pain and still continue the healing process. So Steve, the first one we're going to do is external rotation. So we're going to put a towel down on a wall in your home, and you're going to situate your fist on it. So make a fist, perfect. I'm going to come on this side. I'm going to have you squeeze your shoulder blades like you did on the first exercise, Steve, and you're going to rotate your forearm, your fist into the towel with moderate force and hold it there for 3 seconds again. 1, 2, 3, and release. You may get a little bit of body movement, but for the most part, we're trying to remain completely still. And again, Steve, push. 1, 2, 3. Good. And again, we're squeezing the shoulder blades. Keep the shoulder blades squeezed like we did on the first exercise. And again, Steve, 1, 2, 3. Very nice. Again, you're going to repeat that 12 times, and you're going to do 2 sets of that. Okay? So the last exercise we want to work on is another strengthening one. It's the opposite. It's internal rotation, and again, an isometric to, again, start the healing process of strengthening, but starting it gently. Steve, go ahead and squeeze the shoulder blades again. Perfect. And then this time you're going to rotate into the wall with your fist, keeping the elbow still and at your side. And again, holding it 1, 2, 3, release. Again, hardly any movement at the shoulder. It's all isometric. Again, Steve, good. 1, 2, 3. Very nice. He's doing a better job of keeping his shoulder blades pinched together and squeezed like we learned on the first exercise. And last one for today. Squeeze 1, 2, 3. Again, hold 3 seconds, repeat that 12 times, and repeat that 2 sets of 12. Okay? Do that daily. If you get any increase in pain, please stop. If you feel like you need further guidance, give us a call at M3 Physical Therapy. I'll see you soon.